I'm back again. I am Liz. Sign my name like this, Liz. I'm back again, and I want to share with you guys and show you guys more vocabulary words related to public health and my graduate program. I wanted to share more information related with my studies in graduate school. I've been learning. This is my first week in class this week. I just finished it, and right now I wanted to share with you guys the studies, my concepts related to public health I'm studying. This week I've been studying related to obesity. That means like weight gain, very high weight obesity here in America. I've been studying about that and researching about that. I've been reading some interesting things and I wanted to share them with you. So here's what I learned. I decided the topic that I wanted to research related to public health was how the public health response is here in America to obesity. And like how the public health team responds to that. How do they support and help fix that problem of obesity here in America? That's important for me. Why is that important for me? Because I'm a nurse. I'm a nurse and I work in a public clinic. It's called Primary Care Clinic, and I help people for free. People who have no insurance, people who can't afford to pay for health care, they come to our clinic and they get care, they get seen for free. We have a lot of people in my clinic who have obesity. They have diabetes, type 2, that come to our clinic. Every day I'm seeing these lab results. I'm looking at these bad results because of that obesity. So I researched that. That's been happening for a long time in this country. Has that always been happening here in this country? Or maybe has it been getting worse over time? So I researched. I looked at information from the CDC that said that's increased from the year 1999 and 2000. There's an increase. At that time in 1999, we had 30.5% of adults here in America were obese, and now that's changed over time to the year 2017 to 2020. Now that's increased to 41.9% of adults here are obese. Yeah, that's been getting worse over time. That same time, severe obesity has been increasing as well. That increased. It started at 4.7% and now has become 9.2% in that period of time. Serious, severe obesity. That's CDC information there. That's really important because obesity is related with diabetes. That's the first thing it's related to. And then also it's related to heart disease. That's coronary heart disease. And then the third thing also is related with stroke. Fourth, cancer. Also cancer. And asthma, fifth. And COPD, that's breathing problems, COPD. They tend to be related with obesity, all of those things. And with smoking, COPD also is related with smoking too. So next, how do we respond to that problem of obesity? What do we do about it? It's important to have government support. Scientists can be involved in the research and do research studies and spread understanding related to that problem. What can research studies do? They can help us understand that problem, and research studies can analyze different solutions for that, different treatments for that, for obesity. What can the government do? They can provide financial support for that research, for those research studies. That's the government's responsibility to pay for that research. Medical doctors can provide support too. Yeah, that's also important. Because they care for individual patients one-on-one. They care for the individuals. Patients can go and discuss with their doctor, ask them, what can I do? How can I improve diet and exercise? Take pills for that to improve my weight. The doctors can help with that, and also nurses can help with that. Maybe sometimes like a school nurse could help with teaching programs, teaching kids. The kids could sit down and watch the program, and the nurse could teach them how to improve their diet, how to improve their exercise, and become more healthy. It's important for that to happen in the public schools. It can be taught there, which means also the government is going to be involved with that and helping that program come to the public school children. Maybe the school nurse could also make posters to show how to improve your eating. So also in my research, I saw that people who have obesity, their family needs to be supportive. They need to be supporting each other. Imagine if one person wants to eat healthy and the other people in the family, they don't care, they don't want to eat healthy. That means, it's going to be really tough. That whole family needs to eat together. They need to support each other in eating more healthy. So educational programs need to be focused on having the entire family together. Is it possible for one person to be successful without the support of the family? Yeah, it's possible, but oh man, it's better if the whole family is going to be supported together. Another important thing is called SDOH. What is that? SDOH, social determinants of health. Social determinants of health. What does that mean? Maybe the social environment, the home environments, financial, do they have enough money? That's all SDOH. And that is involved in the care of obesity, because imagine if you don't have enough money, can you pay for special, healthy, good quality food? That's tough if you don't have enough money. Might have something called a food desert. What does that mean? Are there food stores close to their home? No. Or maybe there are food stores, but the food isn't good food. It's not healthy food. Like maybe it's just 7-Eleven. That's not good enough. The food isn't good enough. You need to have healthy, fresh apples, bananas, and there's nothing like that. We call that area, that's called a food desert. If you live in that area, does that mean it's hopeless? You're definitely going to have obesity? They're obviously related, those two, right? Well, maybe not. The research says it's not clear. Having healthy food apparently is not close enough. Why? Because sometimes that healthy food is really expensive. So maybe even if you have healthy food close by, but you can't afford it, so sometimes we think, a food desert, we'll just solve that and then we will solve obesity too. But it turns out it's not that easy. You have to be able to afford the food too. So there's research from Ghosh Dastidar that will be listed in the text underneath. Will show where you can read that study. So now we've talked about different problems, and different solutions, a little bit, Now I'll summarize these three things. First, how do we fix that problem? These are 3 ideas for how to fix that problem. Healthy food would cost less compared with bad food. If healthy food is cheap, maybe I would prefer to buy that cheap food and not this junk food that's more expensive. Maybe give the junk food a tax. Maybe that would improve more people's health, cause more weight loss, because that that junk food is more expensive with a tax on it? Maybe. Give that a tax. Second thing, so the first thing was a tax. The second thing here, encourage people to eat more healthy food. That seems easier compared with giving a tax. Giving a tax is tough. Encouraging the government to require a tax, oh, that's tough. But this second idea, encouraging people to eat, maybe make posters showing healthy drinking milk. Maybe make posters for that? That might be more easy compared with encouraging the government to make a change. That second thing, that reminds me, do you remember back when the got milk? I remember that in the 90s on TV. I remember sitting and watching Got Milk. Yes. Oh, I would prefer milk. Hey, Mom, come on, get me milk. That was very popular. That movie, that advertisement from back in the 90s. So this third thing would be to teach people, when you see that junk food advertisement, when you see that, you need to resist it. You need to teach people to resist that junk food advertisement. That's important. That's the third thing. So the first thing is tax, second one is encourage healthy food, and the third one is when you see junk food advertised, resist that advertisement, teach people to resist that. So now I have a question. What's your opinion here? What do you think of my 3 ideas? Do you think they're good ideas? Do you think they're bad ideas? What's your opinion? Let me know. Give me a movie, give me a comment, let me know your opinion. Now, underneath the movie, there's going to be texts about the study where you can find that information related to obesity here in America. So I want to let you guys all know that. I love you guys. I hope you enjoyed this video. I'm going to give you more videos going forward as I'm going through my MPH program. I'm going to share more information with you guys to let you guys know all inside. Okay, I hope you enjoyed it. I love you.